One of the most surprising threats to your knee replacement recovery has nothing to do with the surgery itself. It's probably sitting in your living room right now, or your bathroom, or the hallway you walk through every single day. Here's what I mean. Your surgery can go perfectly, but then you come home to the same house that you've lived in for years, and that's where things can go wrong. About half of all falls after knee replacement happen at home, caused by things that you've walked past millions of times. Your leg is weaker, your balance is off, and the medications you're taking can make falls even more likely. In this video, I'm going to show you exactly how to prepare your home before surgery. Not as a nice bonus, but as a critical part of your recovery. We'll cover the 3 zones of your home that matter most, what most patients completely overlook, and a simple timeline so that you know exactly when to do what. And unlike some aspects of your recovery that take time, this is something that you can control starting right now. Hi, I'm Dr. George Benajam, Dr. B for short, and I'm a Harvard-trained board-certified orthopedic surgeon who specializes in hip and knee replacements. Even though there's a lot of preparation to consider, it all comes down to 4 simple principles. First, clear your pathways. Most falls happen because something was in the way, like a loose rug, a cord, or a piece of furniture. If it can trip you, it needs to move. Second, choose elevated seats. Chairs and toilets that are closer to the floor force more knee bend to sit down on, and are much harder to stand up from. Sitting with your hips level to or above your knees makes sitting more comfortable and standing up much easier. Third, bring essentials within reach. It's easiest to reach objects that are around waist to shoulder height. Minimizing bending down or reaching overhead helps you avoid losing your balance or straining. Fourth, stick to one-level living. Climbing a few stairs is often possible early after knee replacement, but repeatedly going up and down risks a fall. If you have a multi-story home, setting up everything that you need on just one floor helps you streamline your recovery immensely. Now that you have the principles, let's put them into action. Starting with the place that you'll be spending most of your time those first few weeks. Zone 1 is your recovery command center. That's your bed and your main chair. Your bed should ideally be at the height where your feet touch the floor when you sit on the edge. If your bed is too low, you'll struggle to get up. Too high, and you risk falling getting in. Bed risers are cheap and can make a huge difference if you need to lift the bed just a few extra inches. Now, your main chair shouldn't just be any chair. It should be sturdy, have armrests, and seat you high enough that your hips are level to or slightly higher than your knees. Like I mentioned earlier, sitting higher lets you get up easier, and the armrests let you push off of them to stand up. It's also helpful to set up a small table next to your chair with everything you need within arm's reach. Your phone, medications, water, a book or tablet, whatever you'll use regularly. Be sure to watch out for rolling furniture. Anything with wheels can slip away when you grab it for support or sit on it. Locking the wheels, or even temporarily replacing the furniture with something else, is often the safest option. Zone 1 is where you'll spend most of your time. But Zone 2 is where most falls actually happen. Your bathroom is one of the highest risk areas of your home, thanks to wet surfaces, hard floors, tight spaces, and awkward transfers. Fortunately, most bathroom falls are preventable with the right preparation. First, grab bars help you stand up and keep your balance, and they can be an absolute lifesaver. It's especially helpful to have one near the shower and one near the toilet. Make sure they're anchored into studs or with proper wall anchors, not just suction cups. They need to be capable of supporting your full weight. And by the way, it's dangerous to use a towel bar for support. They aren't designed to hold your weight, and they can pull right off the wall. As helpful as they are, grab bars alone won't make your bathroom safe. There are 2 more items that really complete bathroom safety. The first is a raised toilet seat or commode. Standard toilet seats often sit low, which creates the same problem as a low chair. Raised toilet seats are easier to stand up from, and they usually have built-in armrests for pushing off. The second is a shower chair or tub transfer bench. Shower chairs remove the unnecessary stress of maintaining your balance in the shower in those first few weeks. If you have a tub, a transfer bench allows you to sit outside the tub, swing your legs over, and slide in. No stepping over the edge required. And a handheld shower head helps prevent unnecessary reaching and twisting. One last thing before we leave the bathroom. A bath mat that doesn't have non-skid backing can be just as dangerous as a loose rug. Maybe even more so because it gets wet. Either tape it down or replace it with a rubber-backed mat. And since many bathroom trips happen at night, nightlights in the bathroom and along the path from your bed can help prevent a fall. So you've handled 2 of the most important zones. Now let's make sure the rest of your home won't trip you up. Zone 3 is the rest of your world, your kitchen, your stairs if you have them, and the pathways that connect everything. Let's start with pathways. Your walking paths should be at least 3 feet or 1 meter wide to accommodate your walker with some room to spare. This is where removing clutter becomes essential. Coffee tables, ottomans, magazine racks, anything that narrows the path or could catch the wheel of a walker needs to be relocated. Aside from width, look for cables or extension cords near the walkways. Tape them down or reroute them. And pay attention to the transition between rooms where there's a small step or a threshold that you might not usually notice. Even a half-inch lip can catch your walker wheel or your toe. For your kitchen, keep it simple. Move the items that you'll use the most, like coffee cups, plates, and snacks, down to counter level or an easily reachable shelf. This helps you avoid too much reaching or bending early on. Here's one thing we can be honest about. You're probably not going to be doing much cooking those first few weeks. Stock up on easy meals, accept help from family and friends, and don't feel guilty about ordering food delivery. This isn't the time to prove that you can do it all. It's time to heal. Now, let's talk about stairs, because this causes some of the most anxiety for patients. Check with your physical therapist to make sure you're able to do stairs. But even if you are, it's helpful to minimize them strategically. Every trip up and down is a fall risk, so it's best to minimize unnecessary trips. Make sure your stairs have at least 1 sturdy handrail, but ideally 2, 1 on each side. Your physical therapist will teach you the proper technique for walking on stairs, usually leading with the non-surgical leg when going up and with the surgical leg when going down. Keep the stairs completely clear. No items on the steps and no loose rugs at the top or bottom. And good lighting on the stairway is always essential. And finally, let's talk about pets. I know, your dog is always cautious and your cat is always not trying to cause bodily harm. But after surgery, your balance is compromised, and a pet jumping on you or weaving between your legs can become genuinely dangerous. Consider having pets stay with a friend or family member for the first week or 2, or at minimum, keep them confined to certain rooms. A bell on your cat's collar can help you know where they are. For dogs that tend to get underfoot, baby gates can be lifesavers. At this point, you might be thinking, this is a lot to do. When do I actually do it all? Let me give you a simple timeline that breaks it all down. 4 to 6 weeks before surgery is a great time to order equipment and schedule installations, especially because equipment can take time to arrive. Contact your insurance company to see what they'll cover. Many help with walkers, commodes, and shower chairs. Your surgeon's clinic will likely have information on how to get these, and you can also order equipment online or at a medical supply store. If you need grab bars installed and you can't do it yourself, schedule a handyman now. Don't wait until the week before. This is also a good time to identify what furniture may need to move and where your recovery command center will be. 1 to 2 weeks before surgery, set up your zones. You'll want time to practice using everything before surgery, not figure it out while you're in pain. Move furniture, clear pathways, and roll up rugs. If you already have them, install your raised toilet seat and your shower chair or transfer bench. Set up your recovery chair with your supplies nearby. Stock your house with about 2 weeks worth of groceries, easy meals, and medications you usually take. If you have a walker already, do a practice run. Walk through your house and identify any spots that feel tight or tricky. The day before surgery, do a final walkthrough. Make sure you have plenty of clean clothes ready. The last thing you want to do when you just get home from knee replacement is do the laundry. Do one final check on your bed, chair, and bathroom, and congratulations. You've set yourself up for success. The bottom line is this. Preparing your home before knee replacement is about putting in the work now so your recovery is smooth later. It might feel like a lot, but every patient who has done this tells me the exact same thing. They're glad they did it. Take the time to prepare. Your future self will thank you. Soon, I'll post a video on my top pre-op exercises to get your knee ready before knee replacement. When it's ready, I'll put it up here. In the meantime, I think it's really important for patients to know ahead of time why the first few weeks after knee replacement are so critical, and I'll put my video on exactly that right here. If you found this helpful, click the like button and consider subscribing for more knee replacement education. Stay well, and I'll see you in the next video.